Now, after a week that saw a steady decline in new coronavirus infections, Wednesday witnessed a huge jump in reported cases, with another 14,840 people diagnosed. Such a stunning rise raises questions. Is the epidemic surging again, or is the definition of who's infected evolving? Meanwhile, the World Health Organization gives a new name to the virus, which from now on will be called COVID-19. Will that help reduce the anti-Chinese racism and xenophobia that's erupted in some countries? And how to evaluate the current crisis overall? Joining me to discuss all this from South Carolina, Shi Lu, an associate professor in the Department of Public Health Sciences at Clemson University. From Philadelphia, Mauro Guillen, the Zhang Dan professor of international management at the Wharton School at University of Pennsylvania. And in Beijing, Ms. Han Hua, a research fellow at the Chongyang Institute here at the Renmin University in Beijing. Thanks so much for joining us, ladies and gentlemen. I want to go to you first, Ms. Han Hua. On Thursday, the party secretaries of Hubei province and the provincial capital Wuhan are both dismissed and replaced. Did you see that coming? I mean, why is the change and why now?
Yes, of course, it is definitely a right timing, or even a little bit a late move or action to have this replacement in the personnel. And I think people, especially the media and the public, welcome this gesture of replacement of the personnel and see a very good sign in terms of having active and or more proactive measures towards researching and having management matters towards this human-to-human interface and to how to deal with the pandemic, if we can call that, in the short term and in the long run, to resume the social activities, the social orders, as well as the economic and the social development, not only in Wuhan, in Hubei province, but also nationwide. So there are many preventions and controls to be taken in the new team. Led by the Wuhan and Hubei province new personnel team.
Certainly.
And also, we are certainly hoping for the best ways to protect the healthcare workers in the front line. And we are also thinking of, and on every single day, that the ethnic considerations for the research of the virus from the origin towards the development, and also other social scientific workers can be put together, the resources can be put together to have a more proactive response to not only the concern from the general public in the nation, in China, but also in the world.
Well, talking about concerns, one concern today on Wednesday is the spike in cases. I want to go to you, Mr. Guillen from Philadelphia. Wednesday recorded a huge increase. In fact, we just said 14,840. And the chunk of them, 13,333 cases, are the so-called clinically diagnosed patients. What exactly does that mean?
Well, I think what that means is that perhaps healthcare officials in the city were not able to catch up with the spread of the epidemic, and now they have more diagnosis kits at their disposal, or maybe they have more healthcare personnel available, and they have been able to get a more accurate count of how many people are infected by the virus, which of course is bad news, but I think it should be put in context of the fact that they're trying to catch up with the epidemic.
And Professor Shi, why do you think authorities in Wuhan include the clinically diagnosed method now instead of earlier?
They're learning more about the different ways or social situations in which people may have been exposed to the virus. And I think it's not a bad idea within reason to expand the definition so that we have a more accurate sense of what the problem is. But of course, it shouldn't be expanded too much so that then we overshoot.
So Professor Shi, do you expect a significant increase in the number of new cases now that we have this clinically diagnosing method?
Yeah, we might have a fairly significant number of newly diagnosed cases especially when other municipalities other than Wuhan adopt this new definition, and if the other provinces follow through, we might see a spike of the new cases. And some of these new cases might be false positive, meaning actually they are probably not this SARS-CoV-2 or COVID-19 disease. They are other diseases. They are false positive, so we need to be careful about that too. So the older method of disease definition might underestimate, the new one might overestimate. So just be careful about that.
Well, Professor Guillen, talking about false negatives, I think Professor Shi raised a very important issue. That is false negativity. Nucleic acid testing has been used for diagnosis, but problem is solely relying on that. Over imaging technologies such as CT sometimes can show symptoms of infection in a patient's lung, but the acid testing still shows it is negative. In fact, reportedly, a woman in Chengdu in southern China had 5 tests before testing positive. How do you look at that, Professor Guillen?
Well, I'm not an expert in that. I'm not an expert in that area, but what I would say is I agree with everyone else right now on your show that you need to reduce false negatives. This is really important because if you have too many false negatives, then essentially you will be helping the disease spread. Now, at the same time, is it okay to have a few false positives? Sure, but you don't want to have too many false positives either, because then you're just going to make the problem unmanageable, and people are going to be very upset. So you have to balance, the two issues.
Ms. Han, I want to borrow your expertise. In fact, how reliable is the current nucleic acid testing? Because as far as I'm understood, that is still the mainstream method of testing a patient.
I'm actually not an expert on this regarding the new testing, but I think double measures or even triple measures should be applied into this kind of testing down the road, including because the numbers are really concerning and the numbers are still growing, especially in Wuhan. In the other areas of outside of Hubei province, the numbers are certainly decreasing, which is a very good sign. But it might be including the other measures taken into consideration. So I think including in terms of the testing and in terms of the measures of controlling and containing the growing numbers and having more patients checked into the hospital, especially in Wuhan, is certainly the top priority.
Certainly, we hope that diagnosis will be accurate so that can lead to better and quicker diagnosis and more timely treatment. Talking about naming of this virus, we got a new name for this virus. The World Health Organization announced on Tuesday that the official name of this novel coronavirus will be COVID-19. And when explaining the reason for this naming, the WHO Director General Dr. Tedros Adhanom Ghebreyesus said that under agreed guidelines between WHO, the Animal Heart, FAO, we had to find a name that did not refer to a geographical location, an animal, an individual, or group of people, and which is also pronounceable and related to the disease. So, Ms. Han, what do you think of this new name?
Yeah, I think this is a very clear and easy to be, which is called pronounceable and easy to remember and easy to communicate with the public. So it is a name which is in line with the research results so far, and it also includes the concerns regarding to avoid any mentioning of geographic location, animals, human beings, being individuals or a certain group of people, so that there is no stigma attached to any of the above. Because we had some unhappy memories regarding the naming of an outbreak. For example, like in 2009, when swine flu, as an example, even later it was confirmed the origins of the flu is not just from swine. People already had this impression that, and it was a disaster for farming industry. Later, the news outlets even admitted that it was an unfortunate use of words. Same as MERS, Middle East Respiratory Syndrome. It was like blaming the whole Middle East region for spreading the disease. So people from Middle East were not very happy about the name because it was originated from a certain country. So the same does apply to the SARS, because Hong Kong SAR, they have this overlap of the shortened name of SARS. So Hong Kong people dislike that name at all
Right.
at that time when it was 2003. So the name is very sophisticated.
Well, I think naming should not only can not only stir stereotypes, but that it can only also stir racism and xenophobia. So I want to go to you, Mr. Guillen, Professor Guillen. Do you think the racism charges against China, the anti-Chinese sentiment, is it true, or was it just fear of the unknown in the wake of the coronavirus?
Well, I can tell you I was in London a couple of weeks ago, and people in the subway, in the tube, wouldn't sit next to anybody who looked Asian, not just Chinese. So, of course, this leads to racism or to racist behavior. I am originally from Spain, and as you know, the Spanish flu 100 years ago didn't originate from Spain, it originated from France. But even 100 years later, we're still fighting that stigma. So yes, I think it can lead to racism, and I think that has to be battled. And that's why I applaud the decision by the WHO to name the virus in a way that is not associated with a particular part of the world.
And Professor Shi, as an Asian American living in the United States, how do you feel about this all anti-Chinese sentiment? Is it real, or is it perceived? Is it bad, or is it bad as some media outlets claim?
Well, I have heard one or two anecdotes. Okay, some of the anecdotes actually turn out to be absolute rumor that never even existed. In real life have been falsified. But there was like one or almost two anecdotes when people say things like, "Oh, China virus," go back to China, that kind of thing. But that's much less common than a lot of people would assume. What I do feel is like there is a lot of unnecessary panic among the overseas Chinese community. So they stop the Chinese food delivery. They go to the Asian supermarket a lot less than before, which is absolutely unnecessary. So I think that actually, the problem is that if the overseas Chinese community are falling into that kind of a panic, that might in turn increase that kind of xenophobic among the non-Chinese community. Okay, so otherwise, why are you guys in such a panic? But the turnout is the panic that caused more of like that kind of unnecessary
It's
fear.
really unfortunate. What we need right now are facts, not fear. Certainly not panic. I want to thank all of you, Shi Lu, an associate professor in the Department of Public Health and Sciences at Clemson University, Professor Mauro Guillen at Wharton School at University of Pennsylvania, and Ms. Han Hua is a research fellow at Renmin University. Thanks so much to all of you.